Well, welcome everyone. Thanks for coming. So I'm going to spend, it'll probably be about 45 minutes. She said I have an hour for the presentation. It'll probably be closer to 45 minutes. And a big part of the focus is going to be some more functional medicine testing, as well as sort of treatment options for those tests. I kind of framed it in large part around IBS, because IBS is such a popular diagnosis, but doesn't necessarily get at the core sort of root cause of what's actually happening there. And then I'm going to talk a little bit about celiac disease as well, but what I talk about related to IBS can relate to almost anything, not so much inflammatory bowel disease like ulcerative colitis or Crohn's, but if somebody has questions about those at the end, I'd be happy to answer those questions after I finish the presentation. So I'm Jacob Aguiar. I'm a naturopathic doctor down in Scarborough at Scarborough Integrative Health. It's a clinic we opened about 1.5 years ago, and before that I worked down in Portsmouth, New Hampshire at North Coast Family Health. Yeah, I was there for a number of years. Has anybody here worked with a naturopath before? Naturopathic doctor? 3? Okay, all right, yeah, so a couple. So what's interesting about the naturopathic medical education is there is a massive focus on gastrointestinal health, sort of acknowledging the GI tract as being the heart of the immune system in the body, heart of neurotransmitter production apart from the brain, the central nervous system. And it's also one of the major sort of interfaces between the outside world and the inside world of the body. So we put a lot of emphasis on gastrointestinal health. And more, there's a ton of research coming out now about the microbiome and the associations between the microbiome and mental health, psychiatric issues, cognitive function, inflammatory diseases. So we really take GI health seriously. I also have a specialty in tick-borne illness, since it's such a huge need in this part of the country. It's actually really my primary focus, but every single patient I see, we focus on GI health as well. So that's our info there. And just really quickly, it's a pretty basic outline, but what I will talk about initially is IBS, talk about causes of IBS, and I say just IBS because like I said, I'm looking for an underlying cause. A lot of what I'm going to talk about, like I said though, is going to be relevant to you just have diarrhea, or you have constipation or abdominal pain or some sort of inflammatory process like gastritis or reflux, GERD. It'll all be very relevant. So I'll talk about SIBO. Who's familiar with SIBO? Okay, about 4 or 5 people. Talk about food intolerances. Can I get a show of hands there? A little bit more. And then what about I put other GI microbial imbalances. So there's a lab that I use called Genova, where it's a complete digestive stool test. Has anybody done that kind of test before? It's like 4 or 5. Okay, so probably about 20% across the board for the different tests I talked about. And then probably most people have heard of celiac disease at some point. Speak up. Okay. Been talking all day. I'm going to do my best. Hopefully I won't lose my voice. But doing research into celiac, and I learned this in school, it's really amazing how underdiagnosed celiac disease is in this country. And I'll get into some of the statistics, and it's really shocking once we start to read some of those statistics. So just quick overview about gastrointestinal complaints. Very common cause of office ER visits. Abdominal pain alone counts for almost 30 million visits to the ER or doctor's office. I was actually surprised by that. I thought it would be higher, personally. 300 million people in the country. Nausea, vomiting, 7 million visits, and then diarrhea, 4 million. But what's really fascinating is the actual costs of GI health in the US, GI healthcare, $136 billion. It's a lot of money. It's a lot of money. More than cardiovascular health, kind of shocking, as well as mental health. And that info came from the New England Journal of Medicine. So talking about IBS first. So IBS affects between 25 and 45 million people in the US. So that's 10 to 15% of every single person living in the US has IBS. Not necessarily all of those are diagnosed. You can see here 1/4 to 1/2 of people with IBS. That is supposed to say never consult a doctor. So there's a pretty high percentage of people who don't actually seek out medical care for IBS symptoms, and I'll talk about those symptoms. Typically, people wait an average of 10 years before consulting a doc, and IBS folks report poor quality of life, miss 3 times as many days of work as other people, risk of depression and anxiety. Symptoms, pretty common symptoms. I bet every single person here has had one or multiple of these symptoms different times in life. But these are also symptoms that are very consistent with SIBO, other microbial imbalances, with food intolerances. So that's why we'll spend a lot of time talking about those specifically. And then other symptoms, mostly gastrointestinal in nature, associated with IBS. But when we talk about SIBO and some of the other sort of dysfunction, you'll see there's a lot of other symptoms that can accompany, more systemic symptoms, extraintestinal symptoms like fatigue, joint pain, brain fog, and a variety of others. So, diagnosis. So, IBS is considered a diagnosis of exclusion, meaning other causes have been ruled out, so more serious causes, including inflammatory bowel disease, gynecological conditions are ruled out. Other types of infections like Giardia or E. coli have been ruled out. And the only criteria for IBS is abdominal pain, change in frequency of bowel, and change in form or appearance. Not very specific. It's very non-specific, and so a lot of people fit into that bucket. And so if you don't have some of these other tests done, it's very easy to be diagnosed with IBS. Let me ask this, does anybody know somebody diagnosed with IBS? Can you raise your hand if you know somebody? That's it. Oh, I thought it'd be higher. So a naturopathic approach, this is sort of the naturopathic approach in general. But for IBS, because there's really no agreed upon cause, what we do is look for the underlying issues, the underlying dysfunction, rather than treating purely symptomatically. I mean, I do use symptomatic tools. You know, it's good to address the symptoms, but it's far better to actually address what the core issue is. I don't need to get into that there. But actually, some of the meds for IBS, like dicyclomine, they're called anticholinergics, pretty significant side effects: nervousness, confusion, delirium, fatigue, dizziness, dry mouth, blurry eyes. So I think if you can find a different way to treat it, that would certainly be preferable. So these are the things that I first look for if somebody comes in with IBS, or they even just come in with diarrhea or constipation or gas, bloating, nausea, vomiting, any digestive symptom. I'm typically going to consider doing some of these tests. So we'll talk about each of these one by one. And then the fourth one there, other chronic systemic infections. Being that I have a specialty in Lyme disease and tick-borne illness, essentially 100% of people that come into my office suspecting tick-borne illness have gastrointestinal involvement. So I'm doing these types of tests 5-10 times a day almost. So, and a lot of people, you know, I won't say dismiss IBS, but there's this attribution of IBS to stress and anxiety and depression, and it can be a contributing factor, but that on its own really is not a true cause of IBS. So the first one here, which is one of my favorites, and Nikki here actually works for a company that manufactures a pharmaceutical for SIBO. So SIBO is small intestinal bacterial overgrowth, and essentially it's an overgrowth of bacteria in the small intestine that should be living in the large intestine. There can be other bacteria involved, but it's typically those bacteria that should be in the colon make their way into the small intestine, really where they shouldn't be living. And what they do is they ferment food. When they ferment food, you get gas production, which causes, you know, bloating, gas, diarrhea, constipation, nausea, vomiting. But you can also see there are a lot of non-gastrointestinal symptoms associated with SIBO. And I've had a number of patients who, in addition to the gastrointestinal symptoms, when we treat SIBO, things like headache, joint pain, brain fog, anxiety, depression will clear up as well. And on the SIBO Info website, she cites a study that shows that up to 84% of people diagnosed with IBS have an underlying issue with SIBO. So you figure there's 45 million people in the US with IBS, and about 80% of those what's that, 30 some odd million people in the US probably have SIBO, and very few gastroenterologists or PCPs even look for this. Portland Gastro, they do though, which is great. So I've actually had a number of patients who have seen a doc there who has already diagnosed them with SIBO. They use natural remedies too, which is kind of cool. I don't know, there are a lot of gastros there, I can't remember the exact ones. Yes?
So prior, how long has the diagnosis of IBS been commonly part of the vocabulary?
I actually don't know. I think it's been decades.
Oh, okay.
Yeah.
Before it like got honed in.
What were they using? I don't know. I would have been in middle school probably. maybe high school, I'm not sure. It could have been, you know, just diagnosed as constipation or diarrhea or abdominal pain with an unknown cause. And the thing with syndromes, so anything that has a syndrome in it, basically it's a collection of symptoms and we don't know why it happens. In naturopathic medicine, we look to say, okay, what could actually be that underlying cause? Like fibromyalgia, chronic fatigue syndrome, we're always looking at underlying causes of those things. So these are some of the most common causes of SIBO. Traveler's diarrhea. I've had a number of patients where ever since they traveled to sub-Saharan Africa or, you know, South America, Central America, they had a bout of traveler's diarrhea, which happens almost 100% of the time. It's hard to avoid it. And ever since have never had a normal GI, have never had a good bowel movement. And that could be 5, 10, 20 years. I've seen people where it's been that persistent. Food poisoning is another potential cause. Insufficient stomach acid, really important line of protection for bacteria that are ingested. So, and that can be natural. So pernicious anemia is really common as we start to age. We start to produce less stomach acid. The byproduct of that is an anemia because we don't absorb B12, but it's really, really common for acid levels to start to drop. And it can happen at any age, but it tends to happen more as we get older. And then med-induced. I mean, I'm sure PPIs and H2 blockers, I don't even know how many million prescriptions per year there are. Those are two things that I don't know if I've ever prescribed them because I feel like we have tools to deal with it and actually don't really need to. It is really hard to come off of them though. So tapering down off of those meds is incredibly difficult because you get rebound reflux. So you stop it and your reflux is worse than it's ever been because your body then overcompensates. Yep. PPIs, proton pump inhibitors, and H2 blockers. So things like omeprazole, ranitidine, Zantac, those things like that. Other causes, antibiotic use, which is something I'm always thinking of because I treat a ton of Lyme and tick-borne illness. Sometimes we use antibiotics. I try to use herbals as much as possible. Doesn't always work, so I use antibiotics with folks for Lyme. And sometimes, you know, a byproduct of that could be gas bloating, but I'm always thinking about SIBO during that process. Bouts of constipation or slowed motility, which would make sense if you think about, you can just see here. So here's your colon, here's your small intestine. Right here, there's this little valve, it's called the Ileocecal Valve. And if food is not moving at a pretty good clip through your small intestine into your large intestine, you essentially have this highway for bacteria to migrate from the colon through the Ileocecal Valve into the small intestine, creating SIBO. So some causes could be dietary. Somebody's constipated because they don't, you know, drink enough water, eat enough fiber, activity can be another one. You know, a lot of dairy sometimes can cause, because there are a million reasons dietary-wise that someone can have constipation. Hypothyroidism is another big one. So hypothyroidism causes neuropathy or sort of damage to the small nerve fibers, and those fibers are what innervates the intestines as well. Diabetes, same issue. And then chronic tick-borne illness I had to put up there because I see it all the time. Chronic stress is another one. Abdominal adhesions, whether that's post-gastrosurgery or even gynecological surgeries, I've seen that happen as well. And then incompetent ileocecal valve, so that's the valve that separates the small intestine from the large intestine. If that's not closing appropriately, it's a highway. Those bacteria can migrate right up there. And that actually happens a fair amount. I know of a couple physical therapists that do visceral manipulation. So they can actually put their hands on your abdomen and get pulled to certain areas of restriction, and they can actually be drawn to the ileocecal valve, do a little bit of manipulation, and basically reinvigorate it, get it to work properly again. So rather than doing surgery or invasive imaging, I will tend to refer people to those PTs. Scarborough PT, which is right next door to me, they have a couple really good PTs that do that. And that can be good really general, just sort of in general for abdominal complaints. Same with the adhesions. They can free up some of those adhesions with their work. So I'll talk a little bit about Sibo testing. So we're primarily looking for 2 different gases. There is a third one that is thought to be quite common, but don't have commercially available tests yet. There's one coming, I think, soon. So we're looking really primarily for hydrogen gas and methane gas. And methane gas is essentially, you know, if you're driving by a farm, you smell like the cow sort of gas, that's methane. So, and then hydrogen sulfide is the one that we're kind of waiting to come around, because a lot of people who test negative for the hydrogen and methane may have the hydrogen sulfide form of SIBO. The gold standard is a culture of the ileum, which is the last little part of the small intestine, but that almost never happens because it's invasive. And so all of these tests aren't terribly sensitive, which means there can be a high false negative rate. So someone can have SIBO and the test still comes back negative. That's true for the culture. It's about 30% sensitive. So 7 out of 10 people will have a negative culture but have SIBO. So what's the point in putting somebody through that if it's only going to catch 3 out of 10 people?
And you said that's the gold standard?
It's not great. It's not great. The other 2 are only about 30% as well. Not great, not great. So a lot of docs, so Mark Pimentel, who's like world-renowned expert, he's out at Mount Sinai, he says, if you suspect somebody of having SIBO, they have the symptoms, treat presumptively and see how they respond. And if they respond positively, you make the diagnosis in hindsight, which I do a lot with patients. The tests, so I go through, most of us go through either Commonwealth, Aero Diagnostics, or NUNM, which is a lab out in Portland. I think Commonwealth will bill insurance, but if you pay out of pocket, it's like $175. I think the other 2 are a little bit more expensive. Without getting into a lot of details about the test itself, there's a prep period. You eat proteins and rice, basically. And the idea with that is you're avoiding a lot of the foods that lead to gas production so that you have a low baseline for the test. Then you drink a solution of either lactulose or glucose. We tend to do lactulose because it doesn't get absorbed, and you don't want it to get absorbed from the GI tract because you want it to be food for the bacteria. Because what you're looking for is to see if there's a spike in the gas production when the sugar solution gets to the bacteria. Does that make sense? Okay, all right. And glucose actually gets absorbed before the ileum. If the gold standard is considered a culture of the ileum, that glucose isn't even getting there. So they have it available, but I've never actually done the glucose. Lactulose, because it's a sugar alcohol, we don't actually absorb it. It doesn't get from the GI tract into the rest of our body. And then, so you do the prep, drink the solution, and then collect breath samples every 15 minutes for about 2 hours. And essentially you're looking for very low levels at baseline, and then a spike in gas production, whether methane, hydrogen, or both, before 90 minutes. And the reason before 90 minutes is because at 90 minutes, it's thought that that is the time when that sugar solution gets into your colon, where you should have gas production, because that's where all those bacteria should live. And the classic pattern is the double spike, and I actually had a patient this week that tested that had a beautiful double spike, so I put it on here that I'll show next. And that just says, yeah, so the bacteria are basically fermenting that sugar or sugar alcohol solution, creating gas. And so some folks who do the test actually become very symptomatic, and that's good information right there. You have a question? Oh, sorry, okay, all right. So it's all of those things. So the traveler's diarrhea, the food poisoning, the antibiotic use is because you're really disturbing the normal flora in the gut. Some of the others, like the constipation, the adhesions, the incompetent ileocecal valve, is really more mechanical. There's just an easier sort of path for those bacteria to get up into the colon. So here, okay, that came out okay. So, So this is just showing what the gas production was at baseline, and then every 15 minutes. And then this here is the cutoff between the small intestine and the colon. And what we see for this particular patient is the methane, which is the triangle, stays between 10 and 20 the entire time. So really not much methane gas production, but what you see is the hydrogen at 60 minutes really spikes. And so she did a really good prep, because between the two of them at baseline, it was about 10 parts per million, but her hydrogen was basically flatlined until until 45 minutes, and then from 45 to 60 minutes, she got this really big spike. And so this is what I talked about, sort of this double spike pattern. So this is the spike from the lactulose being in her small intestine, consistent with SIBO, and then by the time it got to the colon, we see that bigger spike, which is exactly what you'd expect to see. Any questions about that? No? And so here it shows essentially what the cutoffs are. And this is talking about difference from baseline. So it's not just what the absolute number is, it's what the change is from the baseline level. And so for her, the hydrogen went from 0 to 33 before it got to the colon. So that would be consistent with SIBO. For this particular patient, and I do this a lot, in the first visit, if it sounds like SIBO, what I'll have them do is do the test, but I actually give them treatments to start the day after the test. And almost across the board, they feel better by the follow-up, and the test is just confirmatory. It's just to have it. But a lot of people want the black and white. I don't necessarily always need it. So these are some of the treatment options. Diet can be really helpful. So low FODMAP, specific carbohydrate diets, which can be prescribed for IBS, for inflammatory bowel disease. I'm suspecting for most people it works in IBS because they have SIBO. It just never got diagnosed. Antimicrobial agents. So I use a lot of herbals. Some of my favorites are candibactins, or a particular type of herbals, certain garlic extracts, atrantil. There is that medication I mentioned, it's called Xifaxan or rifaximin, which works really well. Works really well for the hydrogen form of SIBO in particular. For the methane form, not quite as well. You have to pair it with another med. And I use a combination of the herbs and the medication all the time. The thing about the medication, it doesn't get absorbed systemically. It stays in the GI tract, so you don't have sort of systemic issues with it. It just stays in the GI tract. The herbs do get absorbed systemically, so if there happens to be some sort of systemic infection as well, it can help there. Pro-motility agents, which are basically different types of medications that help to speed up the GI tract to stimulate peristalsis. Because if somebody has constipation and we just give them antimicrobials, if we don't speed up the GI tract, it's going to come right back, like immediately, or it won't ever resolve. So pro-motility agents can be different types of herbals. Iberogast is a really good pro-motility agent. Promodal. There are some medications, one that's available through Canada. Certain enzymes, digestive enzymes, supporting stomach acid. Healing the GI lining, so using things like glutamine or aloe vera gel, fish oils, and then eventually, I don't do this early on, actually replacing beneficial bacteria, sort of getting those bacteria, the good bacteria, back into the colon. Any questions about treatment ideas? Yes?
What's the typical length of treatment for SIBO?
I don't really have a typical. I'm sorry. Yeah, it's usually months. It can be 3 to 6 months sometimes. The Xifaxan is a 2-week course. Sometimes people get a really good bump from that, and then I transition them over to herbals and then stick with that with dietary modification. If they're constipated, I'll use one of those natural pro-motility agents. The med through Canada is called prucalopride or Resilor, and it works really, really well. It's been approved for use in the US by the FDA, but it doesn't get covered by insurance yet. So I use that as well for folks who are really constipated. But usually kind of in the 3 to 6 month range, which, if somebody's lived with it for 20 years, like that's not horrible. Yes? Oops, sorry.
What do you mean by specific carbohydrate diet? And can you tell me what low FODMAP, what you
So those are diets that basically avoid specific types of highly fermentable foods, specific types of carbohydrates, certain types of fibers. And there are some really good diets online. The one that I typically refer people to is on SIBOinfo.com. SIBOinfo.com, and you go to the treatment tab, and then you click on diet, and it's called the SIBO specific food guide, and it's a combo of a low FODMAP specific carbohydrate diet. Yep. And it's really good to look at one of those if you think you may be dealing with this and you want to make some diet change, because there are foods on there you wouldn't necessarily suspect, like certain types of nuts are considered really high in fermentable sort of fiber, and so not appropriate. Other questions? Yes? The herbal ones or the prescription? You should talk. About 99% of the time they are. If they're not, people can get basically a coupon card. So for a 2-week course, it's about $1,000 to $1,500. If somebody has a really high deductible plan, they can usually get a card, and it brings it down to a couple hundred. So it's not cheap, but depending on how symptomatic somebody is, it can be well worth it. You know, if you have very, very poor quality of life because your gut's so disturbed, it can make sense. Some of the herbals I use can range between like $30 to $40, but you may have to be on them a little bit longer ultimately. Do you want to add anything to that about the Xifaxan?
Questions you can ask me after.
Yeah.
I'm happy to answer.
Yep. Yes. They can. So there was a law recently passed for naturopathic inclusion in insurance. I'm really optimistic. I hope it plays out well, because in other states that's happened, and what they usually do is they'll provide one plan, like a really expensive plan that covers naturopathic medicine, but then all of the other plans won't cover it. So somebody has to know to ask for that one plan that covers it. Hopefully it's going to be across the board. But medications, if we prescribe them, if they get covered by an MD, they get covered by us. If you have an FSA or an HSA, you can apply that to, herbal treatments, supplements. Okay, where are we? Okay, other questions? No? Okay. So I'm going to spend a little bit of time talking about food intolerances. So food intolerances are different from IgA immediate allergic type responses. So people think of like allergic to peanuts. That's an anaphylactic IgA type response. Happens basically immediately or almost immediately. Food intolerances tend to be delayed. They can have a quick onset, but sometimes it's 3 or 4 days before the body actually exhibits a reaction to them. And that is really important when we talk about treatment for food intolerances. Yeah, and because it's delayed, how are you going to be able to associate your symptoms to a food you ate 3 or 4 days ago? And you've eaten, so much since that time, it's going to be almost not impossible, but it can be really, really difficult to parse out what food you may be reacting to. So, very familiar GI symptoms, similar to some of the symptoms you see in IBS that you see in SIBO. Other symptoms: skin reactions, headaches, brain fog, aches, pains, anxiety, depression. I would say the list far exceeds that. I would say almost any symptom could potentially be associated with food intolerances because of the effect of increasing systemic inflammation in the body. And I do this, I do food intolerances with like my chronic tick-borne patients, because it can be just another variable that we have to address for them to ultimately get well. So this is not the clearest example, but I had to cut out a little piece of what one of the tests look like. We go through ALA-Test, which is one of the providers of this lab. And this was a really interesting one because this particular patient had a pretty clear cluster of reactions to foods that contain gluten. So what this test is doing, it's basically mixing a patient's serum, which has their antibodies in it, with very sort of refined forms of the food, and then actually seeing what the antibody response is to it. And these here are basically, these numbers are showing what that antibody response is. It's quantifying it, and then the number here is rating it on a scale of 1 to 3. And so there are different basically cutoffs for each of those. So this patient, you can see barley, bran, buckwheat, gluten, malts, and wheat, and rye all showed up. So, and then over here in dairy, and sometimes there are anomalies like cottage cheese didn't show up, but all other forms of dairy did. Those are times that I actually say, let's just avoid dairy across the board. And then I'll talk about an elimination reintroduction diet. And so I'm always really interested when I see clusters like that. So like clusters around dairy, around eggs, around gluten. He also had a pretty high response to legumes. And so, in a case like, like this here, where he had responses to gluten, bran, barley, malt, rye, wheat, even though he had only a 1-star response to rye, I would still have this patient avoid that food. I typically focus mostly on 2 and 3 stars. I don't usually focus so much on 1 stars unless a patient only has 1-star foods that show up. And you can imagine, so this is maybe 30 foods out of a 184 food test. It's a lot of foods. It can be incredibly overwhelming, so I try to simplify the process as much as possible for people. And if this is a child, it's like, okay, you can't have dairy, you can't have gluten, you can't have eggs. It can be really tough to do. But it's not a permanent change. I'll talk about what my approach is next. So, and this is accepted sort of throughout medicine, that really the gold standard for understanding if somebody has a food sensitivity is avoidance and reintroduction. So rather than doing sort of an across-the-board elimination diet, so classic elimination diet is usually somebody eating like goat, rice, and pear, like those 3 foods for a period of weeks. That's all they're eating, and then reintroducing different foods one at a time every 3rd or 4th day. It's a lot. You're basically checking every single food that you would possibly consume. I like using this as a roadmap. I don't take it as sort of as gospel. I take it with a grain of salt and say, okay, we're seeing your body's mounting this immune response to these foods. How important is that really? And that's when we do the avoidance reintroduction. So typically have people just do 2 and 3 stars. I find the 1 stars tend not to be as big of an issue unless that's all that they're showing. And if it's all they're showing, they may also have a bit of an antibody deficiency, an immunoglobulin deficiency, which happens quite a lot in people who are chronically inflamed, chronically infected. And if somebody has sort of an overall antibody deficiency, we see a lower antibody response to everything. So all of these tests will be a little bit lower because of that. So the way I do it is I typically have people avoid usually the 2 or 3 starred foods for 4 to 6 months. Sounds like a lot, but it's usually about 10 to 12 foods, I would say, on average. And then I have them reintroduce 1 food every 4 days. And the day that they introduce it, they're going to eat that food in its purest form 2 to 3 times. So if it's milk that comes up, they're just drinking whole milk or skim milk 2 to 3 times that day, and then monitoring how they feel over the next 3 days. And if they find that they have a reaction, then they keep the food out. If they find they tolerate it just fine, they keep it in their diet. And the key is, if somebody does an avoidance for 4 to 6 months and they don't feel better, I just cut it off there. Because if you don't feel better at 4 to 6 months, none of those foods are likely involved. But if you feel better after 4 to 6 months, 1 or multiple of those foods is at play, and then we just have to figure out which ones it is. And I don't know if I've ever had a patient who avoided those foods and never had some positive response. I would say across the board, there's a positive response. Sometimes they're more profound than others. And then, let's see. Yep, and if you feel fine when you bring it back in, you just keep eating that food. And it can, if you have 12 foods and you're doing it every 4 days and you've already done a 4 to 6 month elimination, that's a total sort of investment of about 8 months. Yep.
How does this testing work if you already have been avoiding food?
Perfect question. It'll show up low or negative. So, but most people, if they're avoiding foods, it's because they already know they react to it. Usually. Like I have a lot of patients who come in already off gluten or already off dairy. I'm not going to make them eat those foods for a month and feel miserable just so we get a positive test. I'll say, hey, if you're already avoiding it, just stay off of it because you already know you feel better off of it. It's the same, I'll talk later about celiac disease. It's the same with that. If you want to get a true look at celiac, if you have to get a biopsy, you have to eat gluten for I think 40 days or so, and you have to eat a lot of it. You can feel really miserable in that time if you have celiac. So the food avoidance is by far the biggest piece of that. Other treatments, working to heal the gut lining. I'm sure they have a lot of these here. I actually don't know, but I'm sure they do. Do you guys have aloe vera gel? Aloe vera gel, you do? Yeah, great. I use aloe vera gel a ton. It's a really fantastic anti-inflammatory for the gut. Take 1 or 2 ounces a couple times a day. Do you take it? Okay, all right. You look very, knowingly. Yeah, aloe can work wonders for people. And there's good research behind it. It's not just sort of a froofy naturopathic thing. There's research that shows it works. What's that? Oh, sorry. Yeah. And then slippery elm. Sorry? Yeah, it makes sense, doesn't it? Yeah. The gut's kind of an extension of your skin, so it makes sense that it would work. It doesn't taste the greatest, but you can always, add something to it, make it a little bit more palatable. The key though is to go for the gel, don't go for the juice. Aloe vera gel is better than the juice. The juice can actually have a bit of latex in it, which can be caustic for the GI tract, so you want to go for the gel. And you can, I'm sure you guys, do you have big gallon tubs of it?
We do.
Yeah, so you can pick it up by the gallon, and yeah, it can work great for, gastrointestinal inflammation, for constipation. I've never used it in SIBO, and I don't know how it would work in SIBO. Because I don't know if it's like a fermentable product, if the bacteria would actually like it. I'm not exactly sure. Slippery elm, marshmallow, glutamine. So glutamine is an amino acid that the cells that line the gut really, really like, and it helps them to divide and replicate and to get healthy again. So, and it's usually a pretty high dose of glutamine, 5 grams twice a day. So a hefty dose. One thing to be careful with glutamine is if you take excess glutamine, it can convert to glutamate, which can be neurostimulatory. MSG is glutamate. So, if you're somebody who has issues with MSG, if you take a lot of glutamine, you could potentially have an issue. Treating inflammation, the aloe vera gel is slippery elm, the marshmallow do that. I use a lot of curcumin in our office, and doing high doses of curcumin, which is an extract of turmeric, which is an Indian spice. It's in a lot of curries. The key with curcumin or turmeric, it has to be in fat, or it has to be what we call liposomal, because it does not really get utilized or absorbed that well, which actually for GI health, it's not as big of an issue. I take that back. If you're using it for more systemic inflammation, like joint pain, muscle pain, you definitely want it to be really highly absorbed from the GI tract systemically. If it's staying in the GI tract, maybe you actually want lower absorption, because then it's going to just coat the tissues. Actually, so doing it dietarily, so using turmeric in food, cooking it with a little bit of pepper helps, ginger helps, using high dose fish oils, 6 to 8 grams a day, which is a pretty hefty dose of fish oils, and then replenishing good bacteria. So high quality probiotics can be beneficial. But really, yes? Yeah, I prefer sauerkraut, pickles, kimchi, things like that. But the benefit of doing fermented foods is you're getting a lot of the anaerobic bacteria, which are basically the bacteria that don't like oxygen. They're going to grow in fermented foods, but probiotics, because they're exposed to air, tend to be all of the aerobes, which are like lactobacillus bifidobacteria. We actually don't have as many of those in our gut as we do the anaerobes, so that's fermented foods are fantastic, yeah. Unless you have SIBO.
Yeah.
If you have SIBO that's untreated, then they're actually not quite as good. I've had a ton of people flare with SIBO by eating fermented foods or taking probiotics. They feel worse than they've ever felt when they do those things. Not always, but sometimes. And then I'll spend a couple minutes here talking about other microbial imbalances. This could be 2 presentations on its own, so I'm going to kind of go quickly through it because there's a lot of components to this type of test. But basically what you're looking at is different imbalances between essentially good microbes in the gut and bad microbes. And that can be bacteria, it can be yeast, it can be parasites, and we'll kind of talk about each of those. And the nice thing about this test that I do, it also looks at pancreatic function. So pancreas is one of the little organs in the GI tract that is really responsible, one, for producing insulin, for blood sugar control, but it's also really important for digestion of like proteins and carbs and fats. So there's some tests in here that can actually show us what the function is of the pancreas. And then I just put there at the last bit, they do what are called cultures and sensitivities. So if there are pathogenic or bad bacteria found in the gut, what they'll do is they'll actually try to grow them out and then treat them with different natural treatments and antibiotics to see what they respond to, what actually kills them off. So the lab I use for this, it's called Genova. It's a GI Ifx test. And this is actually a pretty benign test. This first one over on the left-hand side, this diagram, is basically just a really quick overview. You can see this person has no issues with any particular infection, no inflammation markers, no evidence of pancreatic insufficiency. But what she had was some slight imbalances of beneficial bacteria, as well as butyrate and short-chain fatty acids, which are produced by those beneficial bacteria. And then this is just looking kind of at a spectrum. So the ideal is kind of in here. This is pretty good, and then this is not so good in terms of the beneficial bacteria. And then this little graph here breaks down different grouping of good bacteria, and then shows how basically what a healthy cohort looks like, and then how that patient compares. And then this graph over here, there are times I really pay attention to this right-hand side, but it can be really overwhelming to people. And basically what it's showing is the different types of bacteria that they are testing for, as well as what some research has shown that they can be associated with. And so, for instance, this person has Bacteroides vulgaris was high. That could be associated with IBS, with chronic fatigue, with autoimmune disease, hypertension, mood disorders. I don't tend to spend a lot of time here because it freaks people out, because it's showing that there can be an association, but it doesn't mean that person is experiencing those symptoms because of that bacteria, or that they're going to because of that. It's more an association, not causation. And then this next one, so on the left, so the first one on the right-hand side is just looking at bacteria. This next one on the left-hand side is looking at the other markers that they do. So Pancreatic Elastase is one of the markers of pancreatic function. And you can see that can be associated with some of those conditions. Products of protein breakdown, you actually don't want to see those, because that's meaning your body's not absorbing it. It's actually, you kind of have like a malabsorption issue. Same goes for the fat, the triglycerides, cholesterol, phospholipids. If you see those in the stool, it means your body's having an issue absorbing them, which means you could benefit from pancreatic enzymes, or bile salt sometimes can help. There are also a couple inflammatory markers that it can pick up on: calprotectin, EPX, secretory IgA, and then those bottom ones again are just indication of what kind of good bacteria are in the gut. Yes, it's a stool test. Yep. So yeah, we send people home with a kit. It has a little collection hat and everything in it. So you do your own sample, package it up, send it off to the lab. The requisition has our info on it, so they fax us the results, usually in about 2 to 3 weeks. Yeah. So it's a home stool kit. And so the way that they report the results, it's, I thought I was able to do that earlier, wasn't I? Oh, so the way they report the results, it's a spectrum. So you're looking at essentially what are sort of normal reference ranges are going to be towards the center here, and then we're looking at those that are sort of on either end there. And some of them aren't actually an issue if they're on the low side. So for her pancreas is actually producing really good level of enzymes. There's no issues with protein malabsorption, no issues with fat malabsorption. So seeing these over here is actually a good thing. Her body's absorbing the fat that she's eating. And then looking at inflammation markers, looks great. And then this was one of the areas that was noted in the first chart, which showed that she has some slightly low byproducts of sort of beneficial bacteria, sort of byproducts of their metabolism. And then this is looking at sort of specific bacteria breakdown, which sometimes go through one by one with people, but usually looking at sort of very specific ones. What's interesting is you can't really see it, but this one here, it's Methanobrevibacter smithii, and that can be associated with SIBO because that's a bacteria that produces a lot of methane, and that was one of the forms of SIBO that we know of. And then they do this nice little culture over here on the right. So looking at different types of bacteria that cultured out. None of those are pathogenic, so they wouldn't do what we call a sensitivity. If any of those were pathogenic, like Klebsiella pneumoniae, or if like even things like that, they will do that culture and sensitivity so that we know, hey, this person will do really well on like golden seal or oregano or something like that. And then they also look at candida to see if there's a candida issue in the GI tract. And then they do an ova and parasite test to see if there are any parasites present. And then they just mention sort of the appearance of the stool there. So any questions about that kind of test? No? Okay. So the last thing I just wanted to touch base on was celiac disease because it's so underdiagnosed in the US. So it's estimated it affects about 1% of people, or 1 in 100. And this is celiac.org here, a very, very reputable source. 2.5 million Americans are undiagnosed. That's a lot. That's almost that entire 1% of people. And I just have a little quote there. Most common, one of the most underdiagnosed hereditary autoimmune conditions in the US. So gluten, basically protein found in these foods. The oats, really it's going to happen in oats if there's some cross-contamination. It's not found sort of in pure oats. That's gluten. So for celiac, early diagnosis lowers the chance of developing another condition. So you can see at the age of diagnosis, and then what the percentages or likelihood that somebody will develop another autoimmune condition. And every person that I've diagnosed has been over 20. They're usually in their 40s or 50s, kind of surprisingly. So I don't even know what that percentage would be at that point. Maybe it's like 50%, and each of them has had other autoimmune issues, whether it's rheumatoid arthritis or Hashimoto's thyroiditis. Lupus is another kind of common one it can be associated with. So in somebody who has another diagnosed autoimmune condition, one of the things I tend to do is have them avoid gluten, because even if they don't have celiac, if they have a gluten sensitivity, they could really benefit from gluten avoidance. I want to see if no, I put it later. So these are some of the symptoms. It's a lot. Could be any of those, could be any combination of those. So it's not all gastrointestinal. A lot of folks, and even some doctors, focus almost solely on GI symptoms, not always. Some of the people I've diagnosed have actually had minimal GI symptoms, but have had a lot of symptoms outside of the GI tract, like fatigue and brain fog, depression, joint pain, muscle weakness, migraines. So it's quite common.
So,
Yes.
when you say hereditary,
Yes.
my daughter has celiac.
Mm-hmm.
My husband and I did test was negative.
Mm-hmm. Does she-
was diagnosed at the age of 12.
Okay.
In terms of biopsy.
Okay. Yep.
In terms of hereditary,
Yes.
so does it have to follow the parental line?
It-
Get the generation?
Yeah.
And or second, like,
And it can-
siblings? Is it likely that the other siblings?
So siblings have a much higher likelihood of having celiac than somebody who doesn't have a sibling. Yep. Yep. So diagnosis often delayed. You can see mean delay is about 12 years. So, just looking at these stats, mean delay is 12 years. So you're looking at the vast majority of people are going to get diagnosed between 12 and 20 or over 20 years old. And so they're really set up for other autoimmune diseases right out of the gates. Yeah, often seeing multiple doctors, multiple gastroenterologists before finally getting the diagnosis. And so the strict diagnosis requires a biopsy. So maybe the first step is doing a couple of the antibodies. The antibodies come back positive. Gastroenterologist will then do a biopsy. And the biopsy will show blunting of the villi, which are basically the little finger-like projections in the GI tract that help absorb nutrients. Usually that's blunted. There are some other features that show up. I don't always send people to get biopsies though. One, because it's invasive, it can be really expensive, and everybody I've had who's had high positive antibodies, when they avoid gluten, they feel much better, and then we just stick with it. And by going gluten-free, we're talking strict gluten-free. We're not talking like 85%. We're not even talking 99%. We're talking 100% across the board, have to be gluten-free. Because otherwise, even very minimal gluten intake sets you up for other autoimmune diseases. So in my perspective, it's not really worth it. And it requires an entire household. So you're talking a gluten-free home. Are you guys gluten-free home? Sorry, I don't want to put you on the spot. I apologize. Okay, all right. I shouldn't have done that.
We went totally.
Yeah.
Her diagnosis went into a gluten-free home.
Yep.
She, in recent years, she can tolerate.
Oh, great. So
I don't keep the cooking utensils.
Sure.
Separate anymore.
Yep. So she's still getting. She's just getting parts per million. She's getting tiny. And even gluten-free products, there is an allowable limit of gluten. So they can't have like some parts per million of gluten in them to be technically gluten-free.
So oats have been a big thing.
Oats are a huge one, yeah, for cross-contamination.
My sister makes her whole Thanksgiving, but it's not my nephew, gluten dairy. She makes separate dishes for him, but he doesn't have an issue when he sticks to it like 150%. But she makes other things.
Mm-hmm.
So when
Does he have celiac disease or sensitivity?
he just
Because if he has celiac, the reason I say it's different with celiac, you may not be overtly symptomatic, but there's still that potential for autoimmunity kind of brewing in other areas of the body. If you just have gluten sensitivity, you're looking really more at the symptomatic response to eating gluten.
I think he did what you said instead of going through all the stuff.
Okay, yeah.
He had scopes and he had college.
Yeah.
Tons of stuff.
Yeah.
And he just felt that he just learned a little bit without it.
Mm-hmm.
Then,
He felt better. Yeah.
but huge dairy and
Yeah, so
dried milk and crackers and stuff.
that's common. So often if somebody has gluten sensitivity or if they have celiac disease, because of the damage that's done to the GI lining, they develop sensitivities to all sorts of foods. Lactose intolerance usually develops from that, but they can have a whole host of sensitivities. And if they just avoid gluten, they may actually be able to tolerate a lot of those foods they couldn't before. So cross-contamination is a big issue. So that's why the gluten-free home becomes really important. You also have to look at personal care products, pet foods, hygiene, all sorts of things. Yes? Medications. Yep.
I was pet, so is it that you're touching or that you're smelling the pet food, or what is that?
Well, if it's very hard to keep, does somebody have celiac in that household?
No, but I have gluten sensitivity.
Okay, so you're probably going to be less sensitive to it than somebody who has celiac. A lot of patients I have who have celiac, if they have the slightest bit of gluten, it's like projectile vomiting, they feel miserable. So that's a typical kind of response with celiac.
But if they just that consider how it's protected, how are they going to get contact?
It's hard to keep, I mean, I just think about when I like get my dog's pet food, if I touch it and then I'm touching the toaster or I'm touching something else, it spreads. There's no way to just keep it from the food to the container. But then it takes getting from that surface into your mouth. I mean, if you have a sensitivity, I don't say someone has to be this strict, but if I have a patient who I diagnose with celiac, I really push them to do this because I don't want them to have Hashimoto's or RA down the line and felt like we could have prevented it. And not everybody, is able to do that. It is difficult, especially with eating out. A lot of restaurants these days are actually much better, especially around Portland, but if you go to some other areas, you're in a tough spot with that. And then some other areas of focus with folks that have celiac, repleting certain types of nutrients, like B vitamins can sometimes be an issue, iron can be an issue with malabsorption, certain anti-inflammatories like I talked about previously, healing the gut lining as I talked about previously, and then replacing beneficial bacteria. Like I said, for a lot of GI issues, there's a lot of overlap with the approaches. I think the biggest one is, especially with SIBO, probiotics tend not to be a good thing, fermented foods tend not to be good, but they can be really beneficial in all these other conditions. So I think that's it, and that was about an hour. Okay. Yeah, that's the presentation. I think we have some time for questions. Yeah. So the IBS diagnosis can be helpful, especially if you're going to use a medication. So rifaximin, if it's going to get covered, it's under an IBS with diarrhea diagnosis. So I keep that diagnosis, but I'm treating somebody for SIBO, which is why they have IBS. So like if somebody comes to my office and they have fatigue, they still keep that fatigue diagnosis, but I'm treating them for EBV or Lyme disease or nutritional deficiencies, but they still have the fatigue diagnosis. But to me, IBS doesn't really mean a whole lot. I mean, it said the criteria was abdominal pain and change in stool. Like,
I have IBS-D.
Okay.
So it's pretty specific.
It is. So abdominal pain with diarrhea. Yep. With hydrogen?
I'd have to look at it.
Yeah. Okay. Yeah.
So I was treated with an antibiotic, but not the one you're talking about because it was $1,000.
You can work with her.
So.
You could, I mean, or who are you working with? Whose office?
Dr. Martin.
Oh, I don't know Dr. Martin. Is that an MD or a DO or a DO? So she should get in touch with Salix, who makes the medication, because they've actually helped a lot of my patients when they can't afford it to get it eventually either covered or samples so that they can get treatment.
Then I also worked with a reflux.
Okay, yeah.
Did a test and I checked the positive for mine too.
Oh, okay, yeah, well.
I don't know what to do.
Well, Lyme, we do see a big correlation between those chronic systemic infections and then gastrointestinal disturbances like SIBO. So I would see somebody who can do both. Maybe she can. Maybe 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 do testing for Lyme just to see if that is an underlying issue. But you could also try some of the herbal antimicrobials. Far less expensive and they work. Yeah. Mm-hmm.
So if a person has certain tolerances,
Yep.
and they want to reintroduce them,
Yep.
how do you go about doing that?
So are you saying they had an intolerance, they avoided the food for a while, and they're ready to kind of test it?
No, they really want to start living their life.
They can try. They can go for it.
And if they continue to get sick, or have whatever,
Then they should avoid it.
are those the only options?
Well, kind of. I mean, being a naturopathic doctor, I think if it's a matter of avoiding egg versus having your health, I'm going to steer towards avoiding the egg, and you adapt to it. And most people, not always, but most people, if they do it for a couple months, it just sort of becomes habit at that point. What often happens though is if people avoid foods that they have sensitivities to for a while, their GI tract is able to repair and heal itself, and then they can tolerate them in lower doses. So Yeah. I mean, but then, I talked about like healing the gut lining, using anti-inflammatories, like those are all part of the picture. But usually if you have a strong intolerance to a food and you avoid it for like 2 or 3 months and you bring it back in, you're going to be symptomatic again. So you kind of have to give it time. It takes a while to heal. Does that make sense? Maybe not the answer you wanted to hear, but it's like, if I don't want to use that analogy. I mean, I was gonna say it's like, no, it's not like smoking, but like, if somebody, I'll just use smoking. Like, smoking is bad for you. It's sort of bad across the board, but you still want to do it, and it's causing you harm. You sort of just have a decision to make.
But like that person that you showed with food intolerances was basically everything in the dairy section, everything in the wheat section.
Yep.
I mean,
Legumes. So that's why we don't do it.
live your life if you have.
So that's why one, I don't do the 1-star foods, because it usually shows a lot of them. I only focus on the 2s and the 3s unless they're clusters of foods, and it's for a defined time period. I tell people, if you're willing, and I always work with people, I never tell anybody like this is what you have to do. It's what do you think is manageable? How can we do this together? So if they can avoid those foods for 4 to 6 months, then when they start reintroducing, they may find they only react to like 2 of those foods. And then they avoid those foods for a further period of time before trying to introduce them again, see how they feel. It's kind of a trial and error process. I mean, because we can't really tell when is your body going to tolerate those foods. You only know once you try to add them back in.
But the when is indefinite? Or
Pardon me?
is the when indefinite? When you reintroduce them, that
The when is not definite. But I usually... No, it's not definite. I think you're looking for an answer that you can introduce whatever foods you might be avoiding or something. But the when, the 4 to 6 months that I described should be enough time for that inflammatory response to the food to really settle. If you only do it for like a week or 2, your body's still trying to deal with whatever the ramifications were. So you have to give it enough time. Sorry. Other docs may say something different, but that's been my experience. Yes, yeah.
So the SIBO you said people could have for 20 years,
Mm-hmm.
whatever.
Yep.
Does it go into sort of a dormant state? Like for most
It cycles.
people?
It can cycle.
So you can have all these symptoms and then be great.
Feel better for a while. For years, I'm sure, like, hypothetically, yeah. I mean, I've seen people where they do well for a period of time, and then their symptoms flare again, and they do well for a period of time. Yeah, I have seen.
I just went to the doctor today, and we could have had some really bad symptoms for a month.
Okay.
And so she, I guess,
Uh-huh.
exactly what you're saying.
Yep.
And she wants to send me to a nutritionist. Because I've got the list of the FODMAP.
Yep.
Basically, you're left with like eating 2 things.
Proteins and, yeah, there's not a lot left.
And we
Yeah.
talked about like the nightshade.
Yeah.
That's a whole new thing, right? The Tom Brady thing.
Oh, yeah. Well, it's been around for a long time. Tom Brady made it mainstream. Yeah. Naturopaths and functional med docs, have been, yeah.
But we got like, she told me she had a patient that had IBS stuff for years. I mean,
Yep.
dairy and gluten and everything, and they were allergic to anything in the garlic.
Oh, interesting. We'll probably have a sulfur sensitivity.
It was a special kind of garlic, and I mean, she was avoiding everything classic, and finally, she figured out, so there's hope. There's hope to go through all that.
Oh, absolutely. Absolutely.
Is a good idea
I do.
for someone like you, or do you think?
I think doing things in combination. So, yeah, because the nutritionist, I mean, what I do, I spend a lot of time talking about nutrition, but I can't necessarily spend an entire hour because we have a lot of stuff we have to go through in a visit. But having a nutritionist who can actually help troubleshoot with you, come up with like meal planning ideas, talk to you about where you're having trouble sticking with the diet is really, really helpful.
Do anything that is prescriptive is only put a Band-Aid on it, and it's not.
Who's your doctor? Or you don't, is it a,
The deal at internet, Jennifer Deal.
that's great. Because that's like, I don't hear that a lot. Yeah, great. Because she realizes it is a Band-Aid and it's not going to be a solution ultimately for you. Yeah. Yeah, good. I mean, I would wonder what else could be going on instead of still just looking at it through the lens of IBS and trying some of these things she's heard that works, actually trying to uncover sort of some actual answers to why those things worked. Was it a food sensitivity? Was it low FODMAP because they had SIBO?
Anxiety and stuff like that,
Yeah.
like you said. I mean, obviously you get upset about it. So
Yeah.
your symptoms worse,
Sure.
But are your
Yep.
symptoms making you feel better? It's like a wheel.
Yeah, and you know, do you also have anxiety because when your gut's inflamed, your brain gets inflamed, which happens as well. So it's this really fun thing that we do. Yeah.
Speaking of brain inflammation, I've been avoiding gluten just from reading about it and taking some whatever Maine Health new books and but like from what I've read and heard, gluten can, and I don't think I'm necessarily food sensitive.
Mm-hmm.
I don't know how you feel about this.
Yeah.
I did see an naturopath, Dr. Moore, who wrote the blood code. I don't know if about that.
Mhm.
I was coaching Maine,
Mm-hmm.
which came 2 months ago, but in his test I found I have high triglycerides again, high LDL, and I have hypothyroidism, which he felt for that reason is gluten.
Mhm.
I have been trying, not 100%,
Yep.
but trying not to have much gluten. I don't,
Sure.
because I believe it leads to inflammation in general, from what I, and what
It
I
can.
have also had.
Yeah. Yeah.
Inflammation of the brain is going to link a bit to
Sure.
Alzheimer's, is that correct? So,
Absolutely,
I don't know
yeah.
how you feel in general, if it's best for
Like-
people to, if it's best for people to avoid gluten anyway.
I don't say a lot of things across the board like that.
And
'Cause
something like bread can be so high. When I looked at the 3 bakers bread I love the best,
yeah.
it is so high in carbs that I
Yeah.
oh, wait a minute.
Yeah.
But there's other gluten-free breads that are
They are. Yeah.
have one place a day.
You know, I tell people, I mean, do the avoidance and then the reintroduction, and that tells you your answer. I mean, if you avoided food for 6 months and you notice no difference, I can't imagine it is an issue for you. With celiac, I've never had a celiac patient who can eat sort of a normal, sort of standard American diet amount of gluten and not feel poorly. Sounds like, is it your daughter or your son? Daughter? Can eat a little bit, but I'm sure if she had like a pizza.
No, she can't.
Okay.
So she's been totally gluten-free. She'll say clean. She's 21 now.
Yeah.
She likes to test it every now and then, meaning that, I've been clean now for like 2 years, no contamination.
Yeah.
And it's her birthday or there's a holiday.
Mhm.
Like, that piece of cake or cupcake looks really good. She'll
Mhm.
have it.
Mm-hmm.
It's like, you know what? She's a 5'3", that 100 pounds, very slim.
Yeah.
She will look almost 4 months pregnant.
Because of the
Like a little
bloating and
child.
inflammation that happens.
Now,
Yeah.
and she doesn't have the vomiting or anything like that, but she just feels poorly.
Yep.
All right?
Yeah.
And then it takes at least 2 to 3 weeks
For it to settle.
out.
Yep.
Right? And so she just realized, she did a lot of quote unquote cheek testing.
Yeah.
When she
Just to
was
see.
later in
Yeah.
High school.
Yeah.
And she occasionally tests it, and it's actually quite remarkable what she's tested and how it impacts.
How she responds. Yeah.
She's not on the bottom, the progesterone.
Sure.
But it affects, it
Yeah.
hits her very quickly.
Yep. And with celiac, it's nice. Well, it's not nice, but you get that immediate feedback. With some of the delayed food responses, because it's not immediate, you can't make those really strong correlations. And so that's why the elimination reintroduction is good.
Sensitivity though, there's a lot, like, I don't know if it's
Mm-hmm.
it can say you're not sensitive to it when you are.
Mm-hmm. So that's why the gold.
It's hard.
Yeah, so the food intolerance test that I do, I mean, it's imperfect. All the tests are imperfect. But sometimes with patients, we just do a trial and error to say, hey, these tend to be the top 7 food intolerances or sensitivities that people have. Let's try to avoid those and then try to reintroduce them and see how you feel. So without even doing that kind of test first, just do like gluten, dairy, soy, corn, gluten, dairy, soy, corn, peanuts, eggs tend to be at the high sort of top of the list. So like avoiding kind of that group of foods for a while and see if they feel better.
Do you think though that if you had someone come to you and say, okay, let's avoid dairy, do you mean concrete dairy in front of me, I see it milky, or dairy like dried milk in a Triscuit? Like something
Dairy.
sensitive.
Dairy, across the board. Otherwise, it's not really a valid test, because you can't really trust it. So if you're like 80%, there's always going to be the question, well, you don't feel better because there's still that 20%. And then you really should try to do it as strictly as you can, knowing that it's for a defined period of time. It's not permanent. It's not forever. Could be forever, but usually it's not. Yes?
Is there any correlation between 3 hours and
Ooh, yeah. I would have to guarantee there is. I don't know what the research would show. It would make sense to me. So a lot of inflammatory conditions in the body do create a degree of histamine intolerance or mast cell activation, where the mast cells are sort of degranulating, releasing histamine, and then people have all those histamine type responses. I would have to look, but off the top of my head, I would say there's got to be. Do you know? There is. She says there is. So
There's a couple of podcasts that I could share. Naturopaths and integrative doctors who talk a lot about all the things we're talking about, and they're fabulous.
So she's a rep for Salix, who makes rifaximin, which is one of the pharmaceuticals that can be really helpful for SIBO. Any other questions?
What are your thoughts on like how crops are being treated?
Yeah. Yeah.
Opposed to like the actual protein of gluten
Yeah.
itself.
Yeah. Yeah. I think it's a big issue. So you're talking about like glyphosate or Roundup?
Yeah.
Yeah.
And
Yep.
is that really, could that be a big cause?
It could be. So yeah. So there's some research definitely showing that glyphosate, it's so hard when there are like these massive industry ties and like getting things regulated. But there's good research showing that glyphosate massively disrupts the microbiome in the body. And so maybe symptoms to gluten are because they not only treat wheat with Roundup to prevent pests, but they also do it to dry it out. It's like they give it this nice last sort of treatment of Roundup just to dry out the wheat. So you're getting double doses of it. And so I think, oh gosh, I don't want to get like too like political about it, but there is clear evidence that it really disrupts the good bacteria in the gut. And so maybe as a secondary effect, that's why people have like the GI inflammation from wheat, the intolerance to it. I have patients who can go to Europe and do just fine with wheat because it's not being treated in the same way.
And I agree, like even years ago when we had red meat, they grew up outside.
Yep.
And now they're inside and they're forced
Using antibiotics and yeah.
So some people are sensitive to meat.
Yeah. It could be the feed that they've been given. Yeah. Yeah. So I recommend people eat as much as they, I mean, the thing is, all these foods are way more expensive. So somebody has to figure out how it can fit into their lifestyle and their diet. But I tell people, if you can, go free range, go grass-fed. So grass-fed beef actually has more omega-3 fatty acids than salmon, which is pretty awesome. Most people think of beef as being inflammatory, but if it's grass-fed, it's actually more anti-inflammatory than fish can be. Yeah.
How do you feel about Tom Brady's diet?
I actually don't know what his diet is. It's probably a low inflammation, paleo, low inflammation, no tomatoes, no potatoes, no peppers. Yeah. Yeah. It's mostly, I mean, it's a pretty healthy diet. I don't know, the proof's in the pudding, maybe, I don't know. He seems to be doing well.
Diet helps him to be less joyful and stuff to play.
And to recover more quickly and to be flexible and fluid out there. Yeah.
That you are what you eat. Without that diet, you probably wouldn't be.
Yeah. I mean, he's one example of somebody who's very visible and out there in the public. I mean, it's one person, but I see it every day in practice. I see it in my own life. So yeah, I don't argue it, but yeah. I don't know what else he avoids though. I'm sure dairy-free, gluten-free, nightshade-free.
You're just saying about they can afford to have someone make all.
Exactly. Yeah, they don't have to go through the hassle of figuring it out.
We only drink green.
Yeah. Does like avocado ice cream or something like that, or
His wife doesn't want to do that.
well, what does she do? I don't know. I'm kidding. Yeah. Yeah. Sorry, did you have a comment or question? No? Oh, okay. Sorry. Yeah. Anything else? Anybody else? Yes.
Of the apple, I know we talked about fermented foods and probiotics. Naturally, apple cider vinegar every day.
Yeah. I have people that respond really well to it. I don't know if it's because of the probiotic in it or the way it stimulates digestion. So it's one of those things like bitters that it stimulates the vagus nerve. So you stimulate salivation, you stimulate gastric acid, pancreatic enzymes, you stimulate peristalsis, pretty much stimulates everything along the GI tract. So I think it can be really nice. If people have issues, sometimes if they have issues with like yeast or candida, on the food sensitivity test, it also has a couple different yeasts on there. Sometimes they don't do so well with apple cider vinegar. Like there's this cross reactivity with it.
Do you have to dilute it, or?
I do. You put it, in like an ounce of water or something like that. I don't know what the pH is, but it's pretty strong. Yeah. It would probably eventually start to erode your enamel a little bit if you did it. So your teeth are okay? Yeah. Or swish your mouth out after, or brush your teeth after. Don't brush your teeth after. What does that do? Does that erode it even more?
Wait at least a half hour, please.
Don't do that. Don't brush your teeth after. Swish your mouth out, or use a straw.
How do you do a food sensitivity test? What do you use?
Who do I use? Like a company?
Do you use blood?
Oh.
Are those reliable?
I don't trust a lot of the hair tests. Are there food sensitivity hair tests?
I did one.
How does that work? Well, I'm just wondering, like, how is the test actually valid is what I'm wondering. Because they also do like the nutrient and metal hair test. The thing is, that's picking up on environmental metals.
Yeah.
Almost all shampoos, conditioners are contaminated. So I've seen people with like metals that are just completely off the charts, but it's because they dye their hair or they use shampoos. So I personally don't use a lot of the hair tests. I think it's a way for labs to provide them to the public without needing a doctor. So kind of my personal opinion on them. Yeah. Any other questions? No? Okay.
Yeah, I'm writing it down right now.
Perfect.
And I'll just leave it on the front for everyone to see.
And if you want a card, there's just a stack of cards here. There's also, my email's not on there. Did I put it on my PowerPoint?
Yeah, you did. Yeah.
On the homepage.
Yeah, so I use this email sometimes for patients. I don't check it all the time, but at least a couple times a week I check that email. You could feel free to send some questions there if you had follow-up questions. And there's some cards. Any other questions?
That bowel that you mentioned?
Yes.
It's not a prescription.
It's not a prescription. You can get a gallon for like $10.